53-year-old male here for pain over the right lateral elbow, going on for about a month. He started doing some weight training about a month ago and basically irritated it. It's just tender to touch over the lateral epicondyle. Otherwise, not tender on the back of the elbow or over the medial epicondyle, radial head. He's got good motion. It's tender with resisted extension of the wrist and not so with resisted flexion.
Here we're going to do an ultrasound of the common extensor tendon essentially. Here we're looking at the lateral elbow. This is in a lateral coronal plane. You can see the common extensor tendon and long axis. You can see this curvilinear hyperechoic focus consistent with calcification at the origin of that tendon. And then as we go a little bit radially, you can see this black anechoic signal within the common extensor tendon, basically at the underbelly, separating the tendon from the underlying radial collateral ligament. I believe this is a pretty moderately sized intrasubstance tear, or perhaps tear of the underbelly of the common extensor tendon. Here's a pretty good look at the radial collateral ligament as those fibers really light up in this view. And now we're going to look at this in an axial plane. So here we can see the brachioradialis muscle as well as the extensor carpi radialis longus muscle. You can see this punctate focus of calcification. And here again you can see that black anechoic area basically at the underbelly of the common extensor tendon. And here's also a view of the radial head. You can see the annular ligament that wraps around the radial head, basically perpendicular almost to the radial collateral ligament, it appears. And here again is that calcification in the common extensor tendon near the origin. Here we're going to go over some anatomy of the dorsal aspect of the forearm. Here we're looking at the extensor musculature. You can appreciate the brachioradialis, extensor carpi radialis longus, and brevis muscles. And most of the time the extensor carpi radialis brevis muscle is the muscle involved in tennis elbow. And here we are again zooming in on that lateral elbow. You can also appreciate the anconeus muscle, extensor digitorum muscle, as well as the extensor digiti mimini and extensor carpi ulnaris muscles. And here we're making the extensor carpi radialis brevis tendon thickened and enlarged, consistent with tendinosis. Also, there's an undersurface tear of the extensor carpi radialis brevis tendon. And there's a little speckle of calcification proximally near the origin as well, which you can appreciate here in this model. But again, most of that calcification is intratendinous, which you cannot really see. Now we're making that muscle normal size again, and we're making the surrounding musculature translucent. And here we can get a view again of the posterior elbow. You can see the triceps tendon. You can see the flexor carpi ulnaris muscle as well. And now we're zooming in and we're making the extensor musculature opaque again. Here we're going to look at coronal sections of the lateral elbow. Here you can see the brachioradialis muscle, the extensor carpi radialis longus muscle, extensor carpi radialis brevis muscle, extensor digitorum and extensor digiti mimini, and then extensor carpi ulnaris muscles. And now we're starting to cut through laterally. You can see the thickened extensor carpi radialis brevis tendon consistent with this patient's tendinosis. And now we're going even further medially, and we're starting to cut through some of the other extensor tendons, including extensor digitorum and extensor digiti mimini. And here you can appreciate the radial capitella joint. Also, you can see the articulation of the ulna with the trochlea. And here's a pretty discrete cross-sectional view of the extensor carpi ulnaris tendon. Also, we can still see some of the brachioradialis muscle, as well as the extensor carpi radialis longus and brevis muscles. And here's a pretty good view of the interosseous membrane. Here we're going to go through axial cross-sectional anatomy of the extensor tendons and musculature. Here you can see cross-sectional views of the distal radius and ulnar. You can appreciate the interosseous membrane. And then just going from radial to ulnar, you can appreciate axial cross-sectional views of the brachioradialis tendon. And then you have the extensor carpi radialis longus and brevis tendons. And then you have the first extensor compartment consisting of the abductor pollicis longus tendon and extensor pollicis brevis tendon. And then as you go in an ulnar direction, you can appreciate the extensor pollicis longus tendon as well as the extensor indicis tendon, and then the extensor digitorum tendons. And then as you go further ulnar, you have the extensor digiti mimini and extensor carpi ulnaris tendons. And in this depiction, the second extensor compartment tendons, again consisting of the extensor carpi radialis brevis and longus tendons, appear small, and I think this is in somewhat of a technical error or glitch in the depiction. And here we're going proximally up the arm. You can appreciate again the interosseous membrane. Here you can see the first extensor compartment consisting of the extensor pollicis brevis and the abductor pollicis longus crossing over the second compartment. And this is where you can get a intersection syndrome a little bit higher up in the forearm, higher up than you would expect for de Quervain's tenosynovitis. And here you can see essentially muscle at this level. You can see extensor indicis muscle, extensor pollicis longus muscle. You got extensor digiti mimini muscle and the extensor carpi ulnaris muscle, as well as the extensor digitorum muscle. And now we're going further proximally. You can see the extensor indicis tendon fading away at its origin, and now the extensor pollicis brevis tendon fading away. And now we're going further proximally, and we can see the extensor pollicis longus tendon fading away, and now the abductor pollicis longus muscle, we're approaching its origin, and now it's fading away. Again, you can appreciate the interosseous membrane, and here again is that abductor pollicis longus tendon origin fading away. And now here we're left with essentially, again, the extensor tendons that attach to the lateral epicondyle. So you have the extensor carpi ulnaris tendon, the extensor digiti mimini tendon, the extensor digitorum tendon, and now you can see the extensor carpi radialis brevis tendon, which is thickened, consistent with tendinosis. You can also appreciate still the extensor carpi radialis longus and brachioradialis, more muscles at this point. And you can appreciate we're basically at the radial neck at this point. And we're also probably at the level of the ulnar tuberosity, which is where the brachialis muscle attaches, but we're not showing the flexomusculature in this depiction. And now we're going further. You can see the trochlea capitellum, the trochlea notch. You can still see that thickened extensor carpi radialis brevis tendon consistent with its tendinosis and some of the other tendons attaching to the lateral epicondyle. And as you go beyond the lateral epicondyle, all you're left with are the extensor carpi radialis longus tendon and brachioradialis tendon.